When caring for an elderly patient with thin and fragile skin, the CNA should avoid using A. Fragrance-free lotion. B. Adhesive tape. C. Soft gauze. D. Mild soap. Answer: B. Adhesive tape can easily tear fragile geriatric skin, leading to skin injury or infection. Non-adhesive options are safer. A resident refuses to eat lunch but later asks for food after mealtime. The CNA should A. Tell the resident they missed their chance. B. Save food from another resident. C. Offer an appropriate snack from the kitchen. D. Report the behavior as defiance. Answer: C. Respecting autonomy means accommodating reasonable requests. Offering a snack ensures nutrition and dignity. When applying restraints, CNAs must ensure they A. Tie them tightly to restrict movement completely. B. Use a quick-release knot and check circulation. C. Leave them on at all times. D. Secure them to side rails for safety. Answer: B. Quick-release knots prevent injury and allow emergency removal while ensuring circulation is not compromised. When taking a rectal temperature, the CNA should place the patient A. In Fowler's position. B. On their back. C. In the Sims position. D. Sitting upright. Answer: C. Sims position provides safety, comfort, and proper alignment for accurate rectal temperature measurement. A CNA observes blood on the bedsheet after repositioning a patient. The CNA's first action should be to A. Document the finding at the end of the shift. B. Notify the nurse immediately. C. Wash the sheet and continue care. D. Ask another aide for advice. Answer: B. Any sign of bleeding requires prompt reporting to prevent further injury or detect underlying conditions. When performing oral care for an unconscious patient, the CNA should A. Use mouthwash with alcohol. B. Keep the head flat to prevent discomfort. C. Turn the head to the side to prevent aspiration. D. Avoid using a toothbrush. Answer: C. Positioning prevents fluids from entering the airway, reducing the risk of aspiration pneumonia. Which of the following is considered a violation of a resident's rights? A. Keeping personal belongings nearby. B. Speaking loudly about their condition in public. C. Allowing family visits. D. Offering meal choices. Answer: B. Discussing private information publicly violates confidentiality and resident dignity. A CNA notices that a confused patient is trying to leave the facility. The CNA should A. Lock the door. B. Yell for help. C. Calmly redirect the patient back inside. D. Grab the patient by the arm. Answer: C. Redirection with calm communication maintains safety without escalating fear or aggression. The CNA observes a nurse shouting at a resident. The CNA should A. Ignore it because it's not their responsibility. B. Report it to the charge nurse or supervisor immediately. C. Confront the nurse aggressively. D. Tell the resident to stay quiet. Answer: B. Reporting abuse is a legal and ethical duty. CNAs must act to protect residents from harm. The best way to prevent pressure ulcers is to A. Increase calorie intake. B. Reposition patients at least every 2 hours. C. Limit fluid intake. D. Keep patients seated all day. Answer: B. Regular repositioning promotes circulation and prevents tissue breakdown. Which item should be used to measure fluid intake accurately? A. Soup bowl. B. Calibrated graduate container. C. Teacup. D. Plastic plate. Answer: B. Graduated containers provide precise fluid measurement for accurate intake recording. When providing catheter care, the CNA should clean A. From the drainage bag toward the urethra. B. From the urethra toward the drainage bag. C. Randomly around the area. D. Only the outer tubing. Answer: B. Cleaning away from the urethra prevents bacteria from entering the urinary tract. A resident with diabetes complains of dizziness and sweating. The CNA should A. Give them candy or juice and report to the nurse. B. Ignore it since it's common. C. Check their temperature. D. Offer water. Answer: A. These are signs of hypoglycemia. Quick glucose intake followed by reporting ensures safety. When feeding a resident with one-sided weakness, the CNA should A. Feed from the weaker side. B. Feed from the stronger side. C. Place food randomly. D. Avoid assisting. Answer: B. Feeding from the stronger side promotes easier chewing and swallowing. When assisting a patient to ambulate after surgery, the CNA should A. Walk in front of the patient. B. Stand on the weaker side. C. Hold both arms tightly. D. Walk quickly to build endurance. Answer: B. Supporting the weaker side provides balance and reduces fall risk. Proper handwashing should last at least A. 10 seconds. B. 20 seconds. C. 5 seconds. D. 40 seconds. Answer: B. CDC guidelines recommend scrubbing for a minimum of 20 seconds for effective infection control. Before transferring a resident from bed to wheelchair, the CNA should always A. Remove all pillows. B. Lock the wheelchair brakes. C. Lower the bed to the floor. D. Pull the resident quickly. Answer: B. Locking brakes ensures stability and prevents accidents during transfers. A CNA should wear gloves when A. Making an occupied bed. B. Assisting with oral hygiene. C. Feeding a resident. D. Delivering a meal tray. Answer: B. Gloves are required when contact with body fluids such as saliva is possible. The primary goal of infection control is to A. Keep patients isolated. B. Break the chain of infection. C. Reduce facility expenses. D. Replace antibiotic use. Answer: B. Interrupting transmission paths prevents disease spread among residents and staff. Which of the following is an example of neglect? A. Forgetting to close a privacy curtain. B. Not turning a bedridden resident for long periods. C. Reporting changes to the nurse. D. Assisting during meals. Answer: B. Failure to reposition residents leads to pressure injuries, an act of neglect. When measuring pulse, a CNA should count beats for A. 10 seconds. B. 15 seconds and multiply by 4. C. 60 seconds if irregular. D. Only when resident is awake. Answer: C. Irregular rhythms require a full 60-second count for accuracy. If a CNA accidentally spills urine on the floor, they should A. Leave it for housekeeping. B. Wipe it with paper towels only. C. Clean with disinfectant immediately. D. Ignore it if small. Answer: C. Disinfection prevents the spread of pathogens and maintains safety. What is the safest way to identify a patient before giving care? A. Room number. B. Asking another resident. C. Name and ID band check. D. Bed location. Answer: C. Proper identification prevents medical errors and ensures correct care delivery. A resident complains that their dentures are missing. The CNA should A. Ignore the complaint. B. Report to the nurse and help search. C. Tell the resident to wait until morning. D. Offer someone else's dentures. Answer: B. Reporting and assisting respects the resident's property and dignity. During peri-care, the CNA should always clean A. From back to front. B. In circular motions. C. From front to back. D. Randomly to save time. Answer: C. Cleaning front to back prevents transferring bacteria to the urethra. A CNA notices a resident's call light flashing but is helping another patient. The CNA should A. Turn it off and continue. B. Ask another CNA to assist. C. Wait until finished. D. Ignore it. Answer, B. Ensuring someone responds promptly maintains patient safety and trust. The best way to maintain infection control when removing gloves is to A. Snap them off quickly. B. Pull them from the fingertips outward. C. Avoid touching the outside surfaces. D. Reuse them if clean. Answer, C. Proper glove removal prevents self-contamination from contaminated surfaces. Before weighing a resident in a wheelchair, the CNA should A. Record total weight directly. B. Subtract the wheelchair's weight. C. Estimate the wheelchair's mass. D. Ask another resident for reference. Answer, B. Subtracting ensures only the resident's true weight is recorded accurately. The most accurate way to describe a resident's pain is to A. Guess based on facial expressions. B. Ask the resident to rate their pain. C. Observe quietly. D. Wait for the nurse's assessment. Answer, B. Self-reporting is the most reliable measure of subjective pain experience. When assisting a resident who uses oxygen, the CNA must never A. Keep oxygen away from flames. B. Use petroleum-based lotions near oxygen. C. Ensure tubing is not kinked. D. Report low oxygen levels. Answer, B. Petroleum products can ignite near oxygen, posing fire hazards. When communicating with a hearing-impaired resident, the CNA should A. Shout loudly. B. Face the resident and speak clearly. C. Speak from behind. D. Use complex terms. Answer, B. Visual cues and clear speech enhance understanding for hearing-impaired individuals. When recording vital signs, CNAs should always A. Estimate if unsure. B. Document immediately after measurement. C. Record later at end of shift. D. Leave fields blank. Answer, B. Immediate recording ensures accuracy and prevents data loss. A CNA finds a resident lying on the floor. The CNA should A. Move them to bed immediately. B. Check for injuries and call for help. C. Leave to find a nurse. D. Ask them to get up. Answer, B. Safety and assessment come first. Movement before evaluation can worsen injuries. Which of the following is the safest method to assist a resident in standing from bed? A. Pull by the arms. B. Use a gait belt. C. Push them quickly upward. D. Ask them to jump. Answer, B. Gait belts provide secure leverage, preventing caregiver and patient injury. When assisting a resident with dementia who becomes agitated, the CNA should A. Argue with them. B. Speak calmly and redirect. C. Leave them alone entirely. D. Restrain immediately. Answer, B. Calm tone and redirection help reduce agitation and promote cooperation. Which of the following body systems is primarily assessed when checking respirations? A. Digestive. B. Circulatory. C. Respiratory. D. Musculoskeletal. Answer, C. Respirations measure lung function and oxygen exchange efficiency. To prevent cross-contamination, soiled linens should be A. Carried close to the uniform. B. Placed directly on the floor. C. Held away from the body. D. Tossed into the hallway. Answer, C. Holding soiled linens away from clothing prevents contamination spread. The CNA's role during a fire is to A. Run for safety first. B. Follow race protocol. C. Hide residents. D. Attempt to extinguish large fires. Answer, B. Race, rescue, alarm, contain, extinguish, ensures orderly fire response. A CNA is assisting a resident with a new prosthetic limb. The CNA should A. Force it if tight. B. Report redness or pain. C. Ignore minor discomfort. D. Leave it on overnight. Answer, B. Early reporting prevents skin breakdown and ensures proper prosthetic fit. A CNA hears another aide mocking a resident's speech. The correct action is to A. Laugh to blend in. B. Ignore the situation. C. Report the behavior to the supervisor. D. Warn the resident to be quiet. Answer, C. Verbal abuse violates professional ethics and must be reported immediately.